So welcome to this webinar for graduate students at Tulane University about our fall semester. Let me start out by saying how proud I am of you and how important I think all of you are, not only to the present and future of Tulane, but our country. You include a broad group of individuals across the university, PhD students who are going off to become the scholars of today and tomorrow, and contribute to the erudition of our society. Master's professional students who are going off, in a sense, to improve our world and serve our world and truly make a difference. And to all of you, I want to congratulate you and underscore how supportive we are of all that you do at the university in general. I know this has been a difficult time for you, difficult time for everyone in our society, and you've been facing a lot of challenges isolated. And the challenges are manifest. I mean, we're dealing with a pandemic, literally the worst pandemic of this century, which has meant a whole series of health issues, challenges, risks, insecurities that you are feeling, your friends are feeling, and I'm sure this, the medical impact is felt among friends and family. There's the economic consequences. We've seen a unprecedented unemployment rates, downturn in the economy, which has impacted job prospects. It's also impacted universities. I'm glad to say that while we've had to really constrain ourselves at Tulane University, we've been able to maintain employment and to continue forward. A lot of universities have been seriously impacted, worse than us, both in laying people off, cutting salaries and the like. So I understand this has truly been a difficult time for you, and I truly, all of us at Tulane need to be a family at a moment like this. Given all that, I really also want to congratulate you on how well you handled, in a sense, this transition. I know we went to remote teaching, depopulating the campus. It was a very challenging period, but Tulaneans stepped up to the plate like no other community I've ever seen. And I think the spring semester went absolutely exceedingly well, given all the challenges. And when I look what happened at the university in the medical center, in the research that continued on COVID-19, it truly was an extraordinary time. We were leading the country in the research for both treatments, vaccines, tests, across the board, identifying the origins of COVID-19. So I think while this was a very challenging time for the entire community, I think we should be very proud of how Tulane came through this. Now, of course, in the middle of this, we've been facing some of the most difficult moments I can ever remember as a citizen of the United States. Over the last few weeks, we've seen incidents that have shaken us to the core. And I want to take a moment really for all of us to honor the lives of George Floyd, Breonna Taylor, and all the other individuals who we've seen whose lives have been tragically cut short. You know, as all of you did, I saw the video of some of these events, and it's horrible, but it's also horrible in what it reveals about our society. And I think it has to force all of us to reflect on sort of the inequities and inherent racism in our society, what we need to do about it. Let me say, we all stand with the Black students, faculty, and staff at Tulane University. I will be coming out with a statement about what I think what this means for what Tulane needs to do going forward, in both creating a more inclusive diverse and supportive community and supporting social justice outside our campus. But I did want to at least underscore how important this is to the university, and also underscore that the need at this moment for us to come back on campus. Tulane is a great university and a source for good in society. And through our research and through our education and for the service that we undertake, we really are and need to be dedicated to making the world a better place. And that, of course, brings me to coming back on campus, coming back on ground. And I know there are lots of different schools represented on this webinar with different calendars and different academic programs. So I'll speak generally, and then we can answer questions more specifically about the plans. We've had 6 committees, 6 different committees exploring all the different aspects of how to bring us back on ground. And for those committees, there really have been 2 principles that have guided their decision making. The first is to protect the health and safety of our community. That's paramount. It's critical. And all institutions in this society are going through a similar process. But we have the advantage of some of the best minds in the country on medical issues, both in terms of testing and in terms of treatments. We've been able to consult with really the top people about how best to do this and how best to protect Tulaneans. The other principle that has guided us, the other goal of the other underlying principle behind this decision making is to support the academic program of Tulane University. We need to not only protect our health and safety, but we need to make sure that when we come back on ground, we're providing the best education, undertaking the best research in the country. Those 2 goals were guiding principles. The committees concluded that we should come back on ground, and this is primarily in the, I'm talking about the undergraduate curriculum. It may maybe vary across schools on August 19th, and to have a accelerated semester that goes through the Thanksgiving. That minimizes travel away from campus and makes sure that fundamentally folks are not, in a sense, at risk as they might travel around the country and bring risk back to the people on the campus. The second, in a sense, principle behind all of these decisions is to minimize travel, but also once people are on the campus to really do everything to optimize their safety. The first action we're undertaking is literally to test everybody as they come back on campus for COVID-19. Surveillance testing. That includes students, faculty, and staff on campus, and to engage in periodic surveillance testing of everyone on the campus. The purpose really is to nip any infection before it becomes and spreads, and to take care for people immediately if they should develop COVID-19. We're doing working with, again, top people at the medical school to make sure we have the most accurate tests and that we can do them on a mass level. We're also going to be looking at antibody tests, the test not the presence of COVID-19, but the antibodies for COVID-19, which in a sense allows us to see who has had the disease and may have a certain degree of immunity. So this is sort of the one general way in which we're protecting the health and safety of the campus. Now we're also looking on the campus itself to really have a system of social distancing. And that means in everything that occurs on the campus. The classrooms, all classes, will at least be in a classroom twice the size that is required for the number of students. And that's to allow social distancing. There also will be virtual options in all classes, so that if a student, for example, was still in China and couldn't get in, or we wanted to deconcentrate the class, or that they had come down with COVID-19 and had to be isolated, they would be able, in a sense, to continue the class. We're going through a rigorous program of cleaning everything on the campus to make sure of the health, protecting the health and safety. We're also going to build 6 new temporary classrooms to expand the opportunity, the size and the number of classrooms for classes. In the undergraduate level, we're deconcentrating the dorm, creating more opportunity off campus for single rooms. In terms of employees, again, we'll have more employees working from home, working remotely, or if they are on campus, deconcentrating where they are working to ensure, again, the safety of everybody on the campus. So those are the 2 approaches, both in terms of testing and ensuring that everybody is tested on a periodic basis for COVID-19. And if they do test positive, in a sense, to trace all their contacts and make sure if we nip anything in the bud before it's communicated elsewhere in the community. That's the general outlines of the plan. We also have a committee looking at the culture of Tulane. Tulane is a very relational culture. Social distancing is not easy in a relational culture, so we're thinking through all the different ways we can support that relational culture in a world where there will be, people will be physically more distant. Those are the broad outlines of what we're planning. We have a group of individuals who've been involved in the planning for this process, and I'll just quickly go through them, and they'll be available to answer questions. There he is on the screen, Robin Foreman, our provost, Patrick Norton, our COO, Mike Cunningham, associate provost for graduate studies, Tonette Purcell-Wood, who's associate provost and professor in the School of Public Health, as well as the medical school, Randy Phillipson, overseeing facilities management and the cleaning of all facilities, and Scott Timms, head of campus health, who is overseeing the testing and treatment for this pandemic. Before we start, I wondered if, I know there have been some questions about the health fee and other areas, and I just wondered if Robin wanted to make a few comments about that before we started answering the questions.
Yes, thank you, President Fitz, and I'm happy to. So welcome everyone to the webinar. And let me get right to it. First of all, let me offer a preamble that applies to many of the topics we'll be discussing. And that is that we have a very decentralized system of graduate programs here at Tulane. Unlike the undergraduate program where we have Newcomb Tulane College, a single undergraduate college, we do not have a graduate college. And so decisions about graduate programs overwhelmingly are made within the schools and sometimes even lower down in specific programs or departments. And moreover, the programs, even within a school, can vary greatly in terms of the length of the program, whether they're generally 9 months a year or 12 months a year, and the nature of the funding, whether it's paid for out of university funds or largely out of external sources like grants, and even how students are supported. What is subsidized at what levels varies dramatically. So it's very hard to say anything like simple that applies to all graduate students. But the question is about the student health fee, and I'm sure you all know that all graduate students are required to have health insurance, which gives you access to a broad array of health care options off campus. But it does not give you access to the student health center on campus, the campus health center, either uptown or downtown. And here's where I run into issues because it varies by program. For most grad students, it's an option at present to pay the student health fee. but it's not required. And we had a special circumstance this spring with many of our students leaving campus. The Student Health Center was able to offer their resources to graduate students who were still in town, who were still in New Orleans, at no cost. And the question is about extending that access permanently. I will say, to some sense, somebody has to pay, because generally when all the undergraduates are back and the health center is working at maximum capacity, we have to add resources to the health center in order to make it available for others. So the bottom line is this: for most graduate students, it will still be the case going forward that getting a health fee is an option but not required. We have many graduate students who are working professionals and have health insurance from other mechanisms. But there is a cohort of grad students for whom we play more of a role in supporting them. And I have in mind students who, for any of a variety of reasons, we may be paying a stipend. Generally speaking, those are the PhD students within the time in which they're receiving funding, but that's not a perfect one-to-one match. And even within the PhD students, there are varying flavors of how they're supported and the financial expectations of the program. There's the conversation, as I've told the grad students many times, they have very strong advocates in Mike Cunningham and Scott Timms, both of whom are here on the panel. And they've been working towards a proposal to include the student health fee in with the health insurance and create kind of a single health fee for students. And I received a kind of a formal proposal with numbers attached to it 1 week ago today. And I've shared it with all the deans. And it's a topic of energetic conversation, which is generally positively supported. So I don't have a final announcement to make, a definitive announcement, and I can't make an announcement until we reach an agreement. So I won't make details. I will just say that that is the goal that we're working towards, including the health fee in with the health insurance in a way that, again, I can't announce details until we agree, and it won't apply the same way to every PhD student independent of their school, because currently, the rules are all different. But the bottom line will be including the student health fee in with the insurance without having the student contribution be any more than it is at present. So I think we'll be able to get something that looks very much like that, and we should have precise details. We're very close to sorting it through, but in the next week or two. So it's an issue. I think we all share the agreement. Especially at this time of COVID-19, it's become completely clear that we want our students to get access to convenient, rapid medical care, because it not only keeps them safer and healthier, it keeps the entire community safer and healthier. So we're all on the same page here. It's just we have a lot of details to sort out because the programs differ so much in the details of how they're funded. But I think everything's moving in that direction, and we'll have an announcement soon.
Okay, I know there was some discussion about that. Why don't we open it up for questions, and Carrie Stockwell of the President's Office is going to read the questions that are submitted. Carrie?
Sure, you can enter your questions using the Q&A button at the bottom of your screen. First question, many graduate students are currently abroad in countries that are either facing travel restrictions or visa emission delays, forcing them in many cases to begin fall courses online. Can you please talk a little bit more about the online component of all classes mentioned in the university recommendations?
Yes, so I can start the answer, and others may have details to fill in, because again, it varies by program. But every course we're offering and I say every, but again, there are a few for which it doesn't work. But the first approximation, every course we're offering will have an online portal of some kind. And that's, it's for many reasons. It's one of the reasons is for students who may not be able to get here on move-in day or the day start of classes, but may show up later. It's also, by the way, for students, undergraduates or graduates, who may get sick and have to leave class for a couple weeks, and to allow them to continue their progress in the class. So there will be, and it will vary, what that means and how that will be implemented will vary from course to course. The faculty have a broad leeway to be creative about it. I will say I want to distinguish between the on-ground courses, which have a portal to allow students to continue their progress online, and other courses which are designed to be taken remotely. And that varies from graduate program to graduate program. In several, like social work and public health, for example. There are slates of courses which are designed to be studied remotely. And so in certain programs, you'll have a little more flexibility than courses that are designed on ground with temporary remote access.
Just a brief follow-up. You know, we have been worried about the ability of international students to make it to campus by the beginning of class. And we've been working to create opportunities for them to take classes remotely until they're able to make it with visas to the United States, and in some cases to actually start those remote classes on ground abroad, and then later continue them on ground in the United States.
I can add just a little bit more to that, President Fitz. Part of the issue too, it depends on the country in which the students are coming from. And it also depends on whether you're an incoming student or a new student. And under regular times, the Department of Education limits the number of online courses that international students can take. That's been waived for the spring and for the summer semesters. And it's been waived, we understand, as long as we're in a COVID-19 situation. So whenever the quote unquote COVID-19 situation is turned around, that online portion will be changed also. So for international students who are currently students and who have visas already, they will be treated just like their Tulane and domestic students. New students have to work out with their respective programs because of the visa issues in the country in which they're from, in terms of whether they have Zoom access, whether they have other kind of access to sort of the online education.
There's not a better example of the diversity of the requirements across the schools. I stand corrected, Mike.
But actually, I want to go back to the previous. I saw a follow-up question, if I can address, because I did oversimplify, and I just the vocabulary I was using was suggested that what we were doing was bundling the student health fee with the health insurance, because most of the grad students are using our health insurance, but not all. And so, yes, the plan that we're talking about will involve students who don't have the Tulane health insurance, but still will get some form of subsidized access to the student health fee. But to be honest, that's one of the details that's delaying an announcement. It's one of the many different, elements of this that we have to sort through. So I didn't mean for students who currently have health insurance, then what we are looking at is in some form bundling them, but it won't be required that you have Tulane health insurance to participate in whatever the details of the program are that we'll be announcing.
My next question is about summer funding grants. Many institutions such as Yale and Northwestern have offered all final year graduate students a full extra semester of funding, or have given students additional flexibility about when and how they use summer funding grants. Why hasn't Tulane taken a similar stance?
Yeah, so this is a complicated question because it varies again by school. We did add a year to the kind of length of time graduate students have to meet, I'll say in general, the milestones, including completion, to give extra flexibility. We have adjusted the way we've done summer funding for this summer in some dramatic ways in response to circumstances. And let me give an example. But again, it's hard to say anything universal. Let me give an example. Some of you may know there was a research merit scholarship that was offered in liberal arts, and that scholarship was canceled. And it was precisely in response to this question. You know, we had about half of the proposals for research funding in the liberal arts was for research that could not be carried out this summer, primarily because it involved travel. And it was a competitive award being awarded to 2/3 to 3/4 of the applicants. And then what we heard is, but the students needed that money in any case for housing and food. But then for a brief moment, we were in a very awkward position of offering relief funding to students based on how compelling their research proposal was, knowing that they would not be able to carry out their research, right? Which was a really uncomfortable position. So we closed the merit scholarship and moved that money over to more of a relief fund being administered by Erica Willie, where the funds come from liberal arts, and helping students find access to other funds as well. And it's actually been a great success. Many students got access to expanded government benefits, and we've distributed the money in a much more effective and equitable way by recognizing up front that the money was playing a different role in helping our students continue their work here at Tulane than it might have been in the past. And so different distribution mechanisms seem to better serve circumstances.
Okay, next question is about testing. Do we have a frequency planned for testing? Also, question about, is CAPS going to be open, and will Tulane provide face shields and masks to students?
I can answer most of that. So our plan for testing right now, it's a comprehensive plan, so we're approaching it from several different fronts. We'll have surveillance testing, which our plan, as President Fitz described, is anyone as they return to campus. And the frequency right now, initially, will be at least monthly. And so everyone will be on a rotation, and we'll be doing hundreds of tests every day and processing and getting those back. In addition to that testing, we would also be providing testing for symptomatic individuals or people who might have been contact to a known case. So we're, in addition to the testing program, standing up a contact tracing program. We'll have hopefully an application to help with that, but also have manual contact tracers who'll be doing that work here. So and an infirmary option that will allow us to isolate individuals who are either positive or contacts until we can confirm testing, and that will be available to our graduate students who need a place to stay to risk not exposing family or roommates or other things like that. So pretty comprehensive. CAPS will be open this fall. All of the campus health services will be available. We're working on those plans now on how we can extend those services to make them easier to access, because we do think it will be a stressful time for everyone, and the need for access to both CAPS and the health center will be increased. Both of those services will be available in a hybrid model of in-person and telehealth. So we're hoping that will allow us to actually serve students better. So we've brought all of those things online as we go forward. The testing piece, again, to go back to that for a moment, will be, right now we're talking about doing a nasal swab. Testing technology is constantly changing. I saw some questions. Are we doing pooling? Are we doing all these things? Yes, and maybe, and who knows by the time August gets here, because that technology has just changed so quickly and so rapidly. So right now we have access to a quick test through the School of Medicine, which is really my best resource. It's 12 to 24 hours turnaround, and they're scaling up. We're working on some additional support for that as well from outside labs. So we will have the capacity and hopefully the technology to do this in a way that will not be as uncomfortable as COVID testing was in the beginning. School of Medicine is also working on a protocol for how we will do the serology or the antibody testing that was mentioned. And so all of this will be stood up and will be widely available on both campuses, uptown and downtown. We've also made a series of recommendations around face coverings. So the basic cloth mask that you see people wearing or that have been recommended, and those will be, we've purchased a significant number, so we'll have them available on campus to dispense and are going to be, following the guidelines. But our recommendation right now is that people will be wearing those on campus and in classes, and we're going to make it very easy for people to have access to those.
Next question is about health and safety in the classrooms and laboratories. For science-based labs that typically rely on close contact between the TA and students, for example, using microscopes or performing dissections, will there be formal protocols put forth by the university to maintain social distancing and safety, or is it the responsibility of the department or professors or TAs to navigate those challenges?
We've done a very good job of keeping our labs clean and giving everyone the protective gear they need. We want the work to continue. But that said, we realize that we have, now that we're looking towards repopulating the labs, we do need guidelines. And so we are at work getting in place university-wide guidelines at some level of specificity for repopulating the labs and getting them back to kind of their normal levels of activity. And that should be ready. I'm not actually writing it, so I don't know what stage of completion they're in, but in the very near future. Because, I think it's our faculty and our students are all looking forward to getting back into the lab, and we want to make sure they do so safely. So we will have something ready.
Okay, and we have another question about the library. Do we have a timeline?
Wait. Tonette wanted to add something to the list.
I'm sorry. I was just going to add, on the downtown campus in medicine and in public health, where their labs have stayed open and have continued to operate, I just want you to know that there are processes and protocols in place. Things have been distributed, masks for individuals, the cleaning, hand sanitizers, and the guidelines are being adhered to. Department chairs and leaders are reinforcing the messaging that it's everyone's responsibility that we do this, and if you see something, say something. So the processes, the protocols, the areas are all in place, and they're getting better as more people are coming on board. So just want to reiterate what Robin just said and say it's working in the downtown campus.
Randy, do you want to talk about sort of the process of really inspecting all the facilities at Tulane for both health and safety and cleaning?
Yes, sir. So in conjunction with our industrial hygienists on staff with Office of Environmental Health and Safety, we've engaged a national company with certified industrial hygienists that are going through and doing assessments of all of our facilities. They're working with tenants of each of those facilities. So science and engineering just recently had their assessment, and we look for their expertise as to what takes place in the various spaces, so that we can determine the appropriate protocols for not just the sanitization, but also the ongoing cleaning and operation of those spaces. I know the next question is going to be around the library. We just recently went in Mattis for that assessment. Once we get that, we go into a process of getting those areas sanitized and cleaned. Towards that end, we've engaged, or we're about to engage, a national company that won an RFP for the sanitization of our campuses. That will be taking place within the coming week. They'll begin to ensure that everything is sanitized to the appropriate levels. And then we have written protocols from our consultants in terms of the ongoing, not just cleaning, but also the engineering, how we change filters, what filters we use, constant moderation of our environment. So that's, and even further, we're adding hand sanitizer and single-use wipes throughout both campuses for not just our janitorial staff to use, but also for our entire community to use, in an effort to make sure that everything that could possibly be done safely is being done safely. We're also looking at areas where we can add touch-free sinks or touch-free access into facilities, whether it's classrooms or buildings. And we're also looking at individual classrooms and how those are set up from a furniture standpoint, whether we need plexiglass, what's the spacing, all of those sorts of different social distancing measures that need to take place. You'll also see an increase in frequency of cleaning. So especially high touch areas like elevators, door handles, handrails. You're already seeing it in our downtown campus. You'll see it in our uptown campus. Those will be going on every 2 hours. So a lot of thought and detail has been put in place and is still being put in place as it relates to health and safety.
Hey, Randy, just to add, it's of course more than just the buildings themselves, but it's the services we provide. So there's going to be extensive playbooks on how we, for example, deliver our dining services, how we deliver mail services, how we do shuttles and transportation, how we do events. So I think that's important as well. We're going through every building and making sure that the workspace is the way it should be in a COVID world, and that there's a safe space for individuals, but also the services that are being provided is being looked at as well.
Yeah, and if I can just add to that, because I saw one question about Tidewater in particular, and I'll say, obviously we'll do our best to keep everything clean, but the question was about the elevator. So we're trying to address this issue in creative ways. So every possible space on the first floor is going to be used as a classroom, so that there will be a lot less use of the elevator. In fact, we may be using the first floor space of neighboring buildings so that everything at Tidewater will be a first floor activity. You may have to leave Tidewater to go to class, but you won't have to go to an elevator. But the other thing we're doing is staggering the start times of the classes to reduce the density of folks during those crossover times. And then, of course, we've got a commitment from the facilities folks that all the elevators will be operational at all times. So, and that will help as well. So, you know, there's not just, as I think from the last 3 comments, you get a sense, we're approaching this from every possible direction, right? And
also to state the obvious, right, Robin, it's going to be a fall like no other, right? It's going to be require folks to be flexible, and you know, we'll be doing things that we're not certainly used to doing in the normal fall return.
Right.
Next question is about virtual learning. If my professor is unwilling or unable to teach in person because of health restrictions, will my required course be taught virtually? And conversely, do students have the option of taking classes completely online for the fall semester? For example, if you're a higher risk individual.
Well, those are 2 questions from the kind of diametrically opposing directions. So we have a process in place by which faculty express their concerns about going into the classroom, and it is our goal to make accommodations for those for whom being in the classroom would be a risk. But those accommodations are many different kinds, and it may be that the course is entirely virtual, but it may be that a class of 20 is in a room that seats 200, and you're all spread out with 20 feet between you all. So the accommodations, and there may be plexiglass shields and other things. So the accommodations come in many forms. But that said, there is a chance that the course you're referring to, some course that you need will be taught using technology as a mediator between the instructor and students. But we're exploring ways, even in that circumstance, of making these classes as engaging as possible. Every class, I would say every class that's entirely online is not the goal is not to just have it be an online version of an in-class event where you're just lecturing online, but we have a variety of mechanisms available, training programs, online programs, instructional designers, and everybody else to help our faculty learn how best practices about how to make fully online courses as engaging and rewarding as possible. So our goal is to make sure that even those courses that are online are not simply, a videotaped lecture. As for the second, this will vary a lot by program. There are, there are programs where it will be possible to complete the program fully remotely. And in other programs, it may not be possible to do the full program, but at least some classes. But there won't be a universal guarantee that if we try to, it's not just difficult, it's impossible to create an experience that is optimized for both the students on the ground and the students studying remotely. And where we think it would compromise the experience too much of the students who are present, to also have it available, that same course available to students who are studying remotely, we're not going to end up with that as a possibility. So the answer is, as I mentioned, public health and social work have very robust online programs that will enable you to study fully remotely, and other programs have more limited options, so it will depend on the specific program.
We have a follow-up question about the staggering classes. I've heard the med school and School of Public Health addressed. Will the same protocol as far as cleaning and staggering classes apply to the School of Social Work as well?
To be honest, I have not talked to the Dean of the School of Social Work about their plan to stagger classes, so I just don't know the answer to that.
But the cleaning will be obviously the normal process, the enhanced process that we're going through in the fall.
And I will just add that from the working groups that involve social work, that the Dean's team is actively working on a variety of scenarios that look at the on-class, the hybrid nature, alternating class and class times and class schedules. And so the work is well underway. Decisions are hopefully will be coming soon, but there's a lot of discussion and interaction about that on all of the downtown schools, including social work as well as medicine and public health.
Yeah, so one of the things Jeanette's referring to is something that we haven't mentioned yet, but some of the, it's not staggering start times, but and this is a bit of a caricature, but maybe if the class meets twice a week, half the material will be taught online in some form. And so half the students attend the class on Tuesday and the other half attend the class on Thursday. and do go online for the remainder. So we're looking at a variety of ways of creating classes that allow for safe, both within class and transition, and allow us to offer the most engaging education we can.
Next question is, due to the uncertainty around summer camps and K-12 schools, is a plan in place for graduate student workers who have children by allowing them to work from home being considered?
If you're talking about the academic year, if the K-12 school system is not open, that's going to change a lot of our plans for coming back. And so we are planning now because we have to make plans in July for August, but we can't wait until July to make plans for August. And so if the schools will open up, and then we'll have some other model that we'll be working from.
Yeah, just to add, Michael, you're absolutely right. It's going to change the landscape of the entire city if the K through 12 schools are closed. We are expecting to be open. Our child care facilities are supposed to be open in mid-July, so that's good news. And as you know, Michael said, I mean, we're going to have to be flexible and nimble when it comes to what happens if for whatever reason. And the more likely scenario is a school actually is probably quarantined as opposed to the whole system goes down in the fall if there's a reemergence of the virus in any big way. So we'll have to, like we're doing with a lot of things, we'll have to be nimble and flexible as we move through our planning.
And I just add too that the services that graduate students do for their stipends will be flexible too. And so if a graduate student is a teaching assistant and, for example, has to stay home because the graduate student's child's school has closed, and then perhaps that's the graduate teaching assistant will have to sort of monitor the chats for like the online portion, of a course. We'll have to sort of set up the online exams, some of those things. So some of those things will have to be done remotely. But that'll be a discussion that'll be handled between the graduate student teaching assistant and the professor.
Okay, our next question is about shuttles. We received a few questions. Will there be any changes in this shuttle schedules to accommodate social distancing? There's a comment that the early morning and late afternoon buses are very crowded. And someone asked if we could consider adding more buses. Will other shuttle lines which run during the weekend continue to run?
Andy?
So our shuttle program will continue to operate. We will be making some modifications, obviously putting some plexiglass in to protect the drivers, but also we're looking at the schedule, and depending on where our community is, what the hours of operation are, we're still evaluating whether we're going to continue to make runs to, say, Lakeside Mall and places of that nature. That's still under evaluation. And if need be, we do have contractual relationships with some outside vendors that can supplement our shuttle bus service. Obviously, we're going to operate with social distancing on our shuttles, but if we need to run more or more frequently, we are prepared to do that as well.
Okay, our next question is from an international student. It says, I live outside of the US and I'm hoping to get to Tulane for the orientation. Is it needed for any international students to quarantine for any period after entering the country, or will Tulane require that?
If your orientation is with the Office of Graduate and Postdoctoral Studies, it's going to be online. We're in the process now of doing a remote orientation. And from what I've heard from the school deans is that the school deans are doing remote orientations also, which will be a combination of synchronous, asynchronous, webinars, and we'll be able to put more information up.
I would also add that the protocols around reentry and quarantine and isolation and testing are changing, and we're monitoring those. And so we will have options. There's also opportunities where that could be handled through a testing protocol where you may not have to isolate for as long amount of time, but those have continued to change. And so we're monitoring, and we'll have directions that are clear, and we'll give you some opportunity to plan as soon as we can.
We have a question about Riley. Graduate students pay fees for the recreation center. Will we have full access in the fall?
Yes.
Yeah.
Oh, go ahead, Mike. I was going to say the answer is yes, but one thing you should know is actually we will likely be restricting access to some of the people who currently use Riley in order to keep it safer for our students.
We are obviously need to deconcentrate Riley. Historically, there have been a number of people from outside the campus who've used Riley. I think we have to reduce the usage, limiting it to Tulane, members of the Tulane community. And there may be hours because we need to, make sure it's regulated. So there's true social distancing at Riley.
There's a question about the start of classes. Is the start of classes August 24th or August 19th for all students, including School of Medicine graduate students, or does it depend on the department? And is there a date for orientation, which I think, Mike, you've already touched on?
Yeah, let me say the official university start date has been moved from August 24th to August 19th. But that said, every year there are a variety of programs that have exceptions and start a bit earlier. And so for the specifics, the law school will start a bit earlier, for example, as it does every year. And I'm not sure, quite frankly, about the School of Medicine. Perhaps Tanette can answer the specific, but I will tell everyone, go to your department or school website and make sure you have the right start date for them, because there always is some variation from the official university start date.
Well, I can add from the School of Medicine for the medical students, yes, they're on a different schedule. The fourth year students have already resumed as of June 1st. The third year medical students are resuming right after July 4th. And the incoming first year medical students will be starting July 31st. So those time sets, but that's typical for the School of Medicine because of the start times and because of the curriculum. I spoke with Dr. Blake earlier today, and she oversees the BMS program together with Dr. Gary. And they are on task for starting the graduate programs by the August 19th start date in the School of Medicine. So for those graduate programs, if that helps.
Okay, we have time for one more question. What testing resources are currently available to students who have remained at Tulane and have continued working in labs?
I can answer that. So we're in process of standing up testing centers that will have a variety of hours, both uptown and downtown. But right now, what we have for students is the Uptown Health Center is doing COVID testing. Anyone who needs it can give a call and we will book you in so that you can come by, have that done, and we'll get the results back pretty quickly. It is better to call and try to get booked in for those sorts of appointments just because we're trying to manage socially distant and we have reduced staff here right now. But if you're not sure who to call or what to call, you can reach out to me directly and I can link you up to someone that can help you get scheduled. We've also done some larger groups. So if it's a whole cohort of you that have been working, we do some drive up testing here at the health center as well. So there's a lot of options. Reach out to me directly or you can call the health center for an appointment.
Thank you, Scott. I want to thank everyone. I'm looking up at a screen of all these exceptional members of the Tulane community, but Provost Foreman, Robin Foreman, Patrick Norton, Chief Operating Officer, Michael Cunningham, overseeing as Associate Provost, the graduate program, Tanette Crosell-Wood, overseeing health sciences in the Provost's office, Randy Phillipson, overseeing facilities, and Scott Timms, campus health. I want to, just as a final note, I've thought Tulane handled all of the decisions and change in academic program when we depopulated the campus magnificently. And I want to thank everybody, students, faculty, and staff, for really stepping up to the plate and educationally and in terms of research. And over this period, the hospital and the medical school has been in the forefront in research, and students and faculty in social work and business and law have been deeply involved in the sort of responding to this pandemic. But now, obviously, we're started the process of thinking through how we come back on campus. And you've got to step back and remember that it was 10 or 11 weeks ago that we made the decision to depopulate the campus and do research and learning and teaching and research remotely. We're literally looking at coming back on campus 11 weeks from now. There are going to be a lot of decisions that have to be made, details. You can see from all the different answers to your questions. This is a group of individuals and the committees that have been working on this that have been really thoughtful about how not only to protect the health and safety of the community, but also to offer the best educational program and to undertake the best research. You know, I must say my favorite movie is Apollo 13, where they're trying to work through 1,000 different details of bringing back the spaceship. And in this case, we're working through the thousands of details about how to, in a sense, come back on ground. And we're obviously able to rely on the best minds as part of that process. I encourage you to send us suggestions, give us your feedback on this. This is part of a community effort to bring back this great institution on ground in the fall. So thank you for joining us. Stay safe, stay well, and continue to socially isolate.